The White House phases out a COVID-19 program that pays to test, treat, and vaccinate people without health insurance.
News Channel 12 Shantia Hudson is joining us now live with how this will impact people in our area. And Shantia, what does this mean for folks?
People who don't have health insurance will have to pay for COVID-19 tests out of pocket. This could even mean that some testing sites will close.
Concerning slippery slope from our standpoint.
For the last 2 years, anyone with symptoms could be tested, treated, and vaccinated for free, but not anymore.
For the uninsured, there's now a cost associated with getting tested, with getting vaccinations, with getting treatments, which affects about 13% of North Carolinians and actually 67% of the patients that we serve.
Last week, Congress left out over $2 billion in COVID funding after approving a broad spending bill, something Dr. Aaron Paramzidian says could mean the end to some testing locations.
From a provider standpoint, if you're not going to get reimbursed for the uninsured, then there's a financial burden on you to be able to cover these services. And for some companies, they may not be able to cover it. And honestly, the majority of companies will not be able to cover it.
An issue, he says, doesn't stop at the doctor's office. Insurance companies may also stop covering COVID treatments.
So we're going to see them dropping their public health emergency restrictions and, either having a copay or limiting how often you can get tested.
I asked him what people can do if they're worried about these costs.
We definitely are encouraging people is to reach out to your legislators to make sure that people are hearing about this. Because oddly enough, this is something that sneaked by with everything that's going on in the world right now. Not too many people are understanding how important it is to have the funding for COVID.
He says if providers don't have access to these funds and variants cause COVID numbers to rise again, they may not have the resources to treat people. Dr. Paramzidian also tells me if there isn't any additional funding, then research and future treatments could be off the table. Live from News Channel 12, I'm Shantia Hudson.